Adenoid hypertrophy, hyperplasia of adenoids, and nasal cavity. These depressions are guanae. Here is adenoid. This is opening of eustachian tube. Here adenoid is enlarged. It narrows air passage. Overview. Adenoid hypertrophy is hyperplasia of the pharyngeal tonsils. It only becomes symptomatic if it leads to congestion of the guanae and eustachian tubes. The condition is common in children with recurrent inflammation of the upper airways. Clinical features include mouth breathing, snoring, hyponasal speech, and adenoid facies. Adenoid hypertrophy is diagnosed using flexible nasopharyngoscopy, which should show enlarged adenoid tissue. An adenotonsillectomy is indicated in patients with chronic or recurrent sinusitis, chronic or recurrent otitis media, and asymptomatic nasal obstruction. Epidemiology. It is common in children. The adenoids are largest in children 2 to 6 years of age. Adenoid hypertrophy is very rare in adults. The pharyngeal tonsils slowly decrease in size between 6 years of age and puberty. Adenoid hypertrophy is the most common cause of nasal obstruction in children. Etiology of adenoid hypertrophy. Adenoid hypertrophy can be physiological. Pathological adenoid hypertrophy is due to adenoidal inflammation. It may be due to viral or bacterial infections or allergens. Bacterial infections: Staph, Haemophilus influenzae, Streptococcus, Moraxella, Streptococcus. Viral infections: Epstein-Barr virus. Clinical features: mechanical congestion of the guanae, mechanical congestion of the eustachian tubes. Hyperplasia of the pharyngeal tonsil does not itself cause symptoms. The patient only becomes symptomatic after congestion of guanae and auditory tubes. This is adenoid. Adenoid is also called pharyngeal tonsil. This is nasal cavity, guanae, opening of eustachian tube. Here adenoid or pharyngeal tonsil is hypertrophied and inflamed. So here nasal cavity produces secretion. These guanae produces secretions. These secretions can't be drained due to mechanical obstruction. Here is opening of eustachian tube due to hypertrophy of adenoid. It is also mechanically blocked. So there will be auditory symptoms and nasal symptoms due to blockage of nasal cavity and auditory cavity. Here air current is flowing through the nose and going further into larynx and trachea. Here there is adenoid hypertrophy, so air current is blocked. Adenoid hypertrophy can cause mechanical congestion of the guanae. There will be mouth breathing, hyponasal speech, as air current cannot pass through the nasal cavity, so a person will keep his or her mouth open to breathe, as air cannot pass through the nose during speech, so air will be passing through the mouth, so there will be a kind of nasal voice. Adenoid faces: elongated open mouth face, short upper lip, thin nostrils, malpositioned and prominent upper teeth, hypoplastic upper jaw, high arched palate. These are the characteristics of adenoid faces. Chronic or recurrent rhinosinusitis, nasopharyngitis, and/or epistaxis due to mechanical obstruction caused by adenoids. Infections can occur in nasal cavity. Due to inflammation, epistaxis can also occur. Halitosis, obstructive sleep apnea. Most cases of obstructive sleep apnea in children are due to tonsillar or adenoidal hypertrophy and concurrent obesity. Symptoms include snoring, daytime sleepiness, poor concentration, and poor growth. This is an adenoid face. This is face of the same girl after treatment. Elongated, open-mouthed face, short upper lip, thin nostrils, receding chin, diminished nasolabial fold. These are the characteristics of adenoid face. Mechanical congestion of the eustachian tubes. Due to mechanical obstruction of the eustachian tube opening, there can be recurrent chronic otitis media, tympanic effusion, conductive hearing loss. So there will be developmental disorders, for example, language developmental disorder. If a baby won't listen to words, he won't learn them. Diagnostics. Initial investigation of choice is X-ray nasopharynx lateral view. Flexible nasopharyngoscopy showing hyperplasia of the adenoids confirms the diagnosis. Adenoid. Adenoid. Here hypertrophy is pronounced. It is mechanically blocking the nasal cavity as well as eustachian tube behind it. Treatment. Asymptomatic adenoid vegetations do not require treatment. Adenotonsillectomy or surgical excision of adenoids is indicated for chronic or recurrent otitis media in children, chronic or recurrent sinusitis, severe symptomatic nasal obstruction, for example, obstructive sleep apnea. Treat the underlying cause of inflammation, for example, intranasal corticosteroids for allergies or antibiotics for infection. Thank you.